I am Dr. Ravishankar, a family physician with Medicolegal qualification from the city of Chennai, and we run hospitals. Uh, so we are aware of the need of the patient and the knowledge that has to be imparted to them when they have to go for an acceptance for a certain treatment procedures or a surgical procedure or whatever it is. Every patient will like to know what is the treatment modality, what is the treatment that is going to be provided to them, how the treatment is going to be provided to them. And most often the doctor or the hospital will come and request them to sign down a consent form to express their willingness to undergo for treatment. This most oftenly happens when the patients get admitted to the hospital. When they get admitted, the concern will be to get admission, but that admission does not give the right for the hospital or the doctor to do any surgery or shift the patient into the ICU or whatever it is. So it is now a right to know at that point of time, the admission, where the patient is going to be admitted, who is going to treat the patient, and what is their qualification. Most often, the person who's been taking care of the patient in the emergency is different, and somebody who's going to look after the patient is different. So you have the right to know who is going to look after you or your relative or your kith and kin, and what is their qualification. And that is the right of the patient to know, to choose his choice of treating physician or surgeon, their qualification or whatever it is. And we need to know at what time the doctor will be present. For you to be present there to know the valuable reasons about the ailment that the person is having or the treatment procedure that is being planned for them. When they ask you for a consent to shift the patient to the intensive care unit, you need to know what are the complications for the patient, what are the organs that are being involved, necessitating the patient to be shifted to the intensive care. Quite often, it will be a cardiac problem, or it will be a respiratory system, lung problem, a respiratory system problem, or there may be a sepsis infection for the patient. A simple dengue fever itself with a delayed treatment can result in the low platelet count and go in for a shock and problem, and that will be needing to have